I've done little clips before.
Yeah.
Okay.
Little spaces
Okay.
So the swelling, basically you'll have swelling on both sides of your hip from
Yep.
your replacements. The reason being is that when we do the operation, because we don't cut any muscle, we have to
Right.
go between two muscles.
Right.
So in your body, before we make that incision or make that entrance, the two muscles are glued together by fascia or this layer, okay?
Okay.
But I have to get in there, so we make a potential, the space is a potential space. It's not there in a normal person, but in the operation, we have to make that space to do the operation. So that space then is low pressure, and so fluid will accumulate in that as swelling, and that's very normal. Everyone has that.
Okay.
So they'll be very swollen,
Yep.
especially here, especially exactly where you have them,
Okay,
kind of
that's
like
good.
full here. You'll have bruising all the way down, even to your toes,
Yep.
and that's just from A, being on a blood thinner, and 2, the operation. But that's pretty normal.
Okay. Super. And one of the questions I want to ask, because I think it'll be helpful for people, is that you use the anterior approach to access the hip joint.
Yeah.
I know, there's two other approaches,
Yeah.
posterior and lateral. Can you just tell me why you use that approach and what the advantages are to it? Because I certainly feel there's advantages.
Yeah, I think the reason I like to use the approach is that it's a muscle sparing procedure, so you don't cut any muscle when you're doing the replacement. So